Attention deficit hyperactivity disorder is a condition that affects a lot of young people and adults, and it's sort of composed of difficulties with concentration and distractibility, as well as difficulties with restlessness, hyperactivity, and impulsivity. And in order for a diagnosis to be made, a young person either has to have inattention difficulties or hyperactivity difficulties, or a combination of both. Assessments in the practice are carried out by child and adolescent psychiatrists or a specialty doctor, and the assessments are composed of clinical assessment. They're comprehensive and multidimensional and capture all aspects of a young person's functioning, including how they're getting on at home, school, as well as their social functioning. Our ADHD assessments are in line with best practice guidelines recommended by the National Institute for Health and Clinical Excellence, otherwise known as NICE. At the Edinburgh Practice, our assessments are split into 3 appointments, each lasting approximately 1 hour. At the first appointment, a young person and their family will meet and just for an initial general conversation around ADHD and whether they understand what that means and the implications for them. In that appointment, we will begin to address the difficulties that young person faces, getting information from the young person as well as their parents. Importantly, their mental state will be assessed, and we will also trawl for any other mental health difficulties that may be co-occurring with the potential ADHD symptoms. At the end of that appointment, we ask the young person to sign a consent form to make sure that they understand what the implications of the assessment and what it means for them. We also ask parents to sign a consent form in order for us to contact the school. This is a really important aspect of our assessment process because information from the school is key to confirming this diagnosis. It has to be witnessed across different domains in the young person's life. We send what we call SNAP 4 questionnaires to the school as well as parents, and the school are also sent a very detailed questionnaire trawling for all aspects of a young person's functioning, including ADHD symptoms, but also their strengths and their social functioning. The young person is given what we call a DIVA 5 questionnaire, which trawls for symptoms of ADHD, and this offers us a very rich lot of information regarding the ADHD. So that's the first appointment and the procedure. There's a second appointment attended only by parents, and that appointment is an opportunity to discuss in depth the young person's development, looking at all aspects of their functioning and also including all aspects of any potential neurodevelopmental difficulties. So once we've gathered all the information regarding the young person, we have the SNAP questionnaires back from parents and the school, as well as the in-depth school interview questionnaire, as well as the DIVA from the young person. A feedback appointment is arranged as part of completing the process. In this appointment, the diagnosis will be confirmed or not, as the case may be, depending on whether the young person's symptoms fulfill the diagnostic criteria for ADHD according to the DSM-5 manual. In this appointment, if the diagnosis is confirmed, we offer advice with regards management moving forward. This includes advice around behavioral, social, as well as psychological management. An important aspect of this feedback appointment is thinking about the implications in the school, which is where the young person really does need to be able to focus. Medication is one of the another strand to our input with regards management, and sometimes medication can be initiated at that feedback appointment. A comprehensive report summarizing the outcome of our assessment is made available to the family and GP as soon as possible, and we also send a separate letter to the school confirming the diagnosis and requesting appropriate support. If you have any questions or queries regarding these assessments that we offer, please do get in touch with us.